Good evening, I'm Dr. Curtis Doyle, and this evening we'd like to discuss electronic medical records. As you know, medical record systems are either hard copies, paper copies if you will, or electronic systems that are used to organize and catalog information pertaining to the patients that are being seen. Computerized medical records are the digital counterparts to patient medical records kept in paper files. They are, in essence, an electronic version of the same medical record paper file that's maintained in a physician's office. While computerized medical records may be referred to as individual files or folders, the goal and purpose of using these records is to have a resource devoted to storing complete and accurate information about a patient. Well, central to all of the medical record system is all the information of a patient that we would need. The gender, the age, contact information, next of kin, insurance policies, if any, and other information such as who may access the records, which is authorized by the patient. So they're also capable, these records are capable of storing many years of information regarding doctor's visits, laboratory results, surgical procedures, hospital stays, or any medication that's prescribed either on a long or short-term basis. The use of electronic medical records has generally met with a great deal of support because it is very possible to accurately and quickly and securely transfer data files within minutes in the event of an emergency. There are always advantages and disadvantages to any system, and there are also with electronic medical records. Some of the arguments that we hear argue that the positive aspects of employing a medical record system outweigh the disadvantages. So there's cost savings, it saves space, and instead of keeping huge paper files, all records are kept on computer files. Along with this saved space, of course, is the reduction in the use of paper. So computer medical records do not render paper obsolete, but they do reduce the needed paper significantly. Another advantage is the ability for all in a healthcare team to coordinate the care of a patient. It avoids duplication of testing, prescribing medications, and other things that could be dangerous to the patient. It is also provides the ability for anyone on the medical team to understand the approaches taken to a condition and those treatments that are given by other healthcare professionals. Many procedures that used to take hours can now be accomplished in much less time. The electronic medical records can be searched quickly, making it possible for a physician or other healthcare practitioner to review records going back a number of years without wading through large amounts of printed documents. That can be archived to remote servers. So any event that, as we experience throughout some cities in the United States, tornadoes or whatever, which has destroyed hospitals and clinics and medical records, if they were paper files, they're gone. But if they're electronic versions, they can be retrieved and a new hard copy file assembled. So these archived records, though, they're only accessible with proper credentials. So it's even less chance of record tampering than there would be with hard copies. Despite training, though, many people creating medical records are nurses and doctors and other healthcare practitioners who are not necessarily technologically advanced. So we must make sure that all of our staff are trained in the use of electronic medical records so that time will not be taken away from the patient when they're reviewing these documents. So patients who have gone to doctor's offices with electronic medical records feel that the physician has had to divert their focus into their computer and accessing the information as compared to being there with the patient and providing them an on-hands treatment program. So, but along with reduction in doctor-patient time, some people find that the systems and have depersonalized doctor visits. There's not one electronic medical system. There is a problem in that. There are many. It is a profitable business. So streamlining patient care can only be achieved when a single system is used. If two or more systems are used, they may not be compatible. So the doctor uses a system, and then the hospital uses a different system. They cannot transfer the data back and forth. And one of the concerns is the security. And that shouldn't really be of any major problem. Hackers do get into information just because they can. Not that they're looking for a specific person under normal circumstances, but because no one else has done this and they're going to hack it into it. I think this is probably minimal, and we should not have to worry about the safety and the confidentiality of our medical records. But what we have is an electronic medical record system. What we must do as healthcare professionals is to find a way to make all these systems compatible in some way or another. And the reasons for that is if you're traveling from one city to the next or one state to the next, that you can go to a doctor's office if necessary, and that office can access your medical records, see what sort of treatment and medications you're receiving, and then provide quick, accurate, and safe diagnoses and treatment to our patients' benefit. So there are pros and cons. I feel that the records possibilities outweigh any negative problems that my physician uses medical records electronically. I do not feel that anything is taken away from me when we're in the office. But again, if we don't train our staff, there could be problems. Thank you very much. If you have any questions, please send me an email. We'll make up a schedule for a time we can get together and discuss any problems you're having with the subject of electronic medical records. Good evening.